Hi everyone, my name is Dr. Gayatri. I'm a GP in the NHS and a functional medicine doctor. So when I tell people that I'm a functional medicine doctor, most people look at me fairly confused. They have no idea what it is. So I thought, let me do a video just to explain exactly what it is. So first and foremost, I want to reassure you that it's not woo-woo and it is all completely evidence and science-based. So the type of medicine that I practice views the body as one unique integrated system, looking at the way all of the body's systems work together instead of isolating single organs or dividing them into different medical specialties. So us practitioners are really trying to seek and identify the root cause of your symptoms to correct imbalances and find long-lasting healing that supports the body, the mind and spirit as a whole, and it's completely personalised. So we understand how all of our different parts, all of our different body parts, they work together. And we look at symptoms as a sign of dysfunction that we need to get to the root cause of, not just tame it, and not just give it a name or a title. So by using the principles of functional medicine, people just like you experience transformational change. You might be suffering from mystery headaches, skin problems, non-specific chronic pain, diabetes, exhaustion, high blood pressure, joint inflammation, even digestive symptoms. I mean, the list is really endless. You might even have been diagnosed with ME or chronic fatigue or even fibromyalgia. So how frustrated do you feel when no one can make sense of your illness, never mind getting you the help that you need to get you better? So your mix of symptoms is your body's cry for help. Lots of our patients come to us having been unable to work for years. They can't think clearly, they've got broken, impaired relationships, they feel that they're just about surviving, and they've really lost their zest for life, which is sad, which is just really sad. So in the few years that I have been practicing functional medicine, I can't tell you how many patients I've seen recover from chronic illness and create the health that they've always wanted using these principles. Now, one of the most common criticisms of functional medicine is that there isn't enough research to support it. This isn't true, of course. There was a study that was published in the Journal of American Medical Association, and they took a unique approach to addressing this challenge. And rather than looking at specific interventions, they simply compared the results of a functional medicine approach with a conventional approach. So to do this, they performed a retrospective analysis of about, I think, 7,000-ish patients who were treated in the functional medicine setting with matched patients who were treated in the conventional primary care setting. So they assessed improvements using a validated quality of life scales at 6 and at 12 months. So at both 6 and 12 months, improvements in the patients that were treated with functional medicine were significantly larger than those that were treated with conventional medicine. So this is a great step forward for functional medicine. I wanted to explain a little bit more about functional medicine and how we practice it. So I wanted to tell you that we take a very different perspective of the human body, and we're looking for the interconnectedness between every single system. Now, obviously, there is a need for prevention and keeping people well and healthy in the first place. And I can show you how these integrated measures allow us to successfully do just that. The functional medicine matrix, so this is our matrix, it's our framework to do this. So this is a lens that helps us look at the body's systems, symptoms and risk factors and see the story patients tell us about why they got sick in the first place and clues on how they can get better. We connect the dots between all of your symptoms. So using a foundation like this matrix, we can see that two people might have the same symptoms with very different root causes or vice versa. Now, the reason functional medicine is so powerful is that it looks at the individual. It accounts for the unique subtleties in all of our bodies and where each needs support. So specifically, the matrix works of a series of biological systems that we call nodes. So there's assimilation, defense and repair, energy, biotransformation, transport, communication, structural integrity. So these categories, they help us do the detective work in a very organized way. We can pin down the problems and then we can take the most effective treatment route. It also takes a deep look at the patient's story. So this means identifying family history, triggering life events, lifestyle choices that might have mediated or perpetuated the symptoms, and then the emotional, mental and spiritual state are also an equally important part of this full picture. So considering how comprehensive this approach is, it's not surprising that studies have found that patient health outcomes are far better and sustainable with this than with conventional medicine. Conventional medicine provides the framework for us to feel our best. Now, whether that means preventing diseases that we're predisposed to genetically, cleaning up years of poor dietary choices, or tackling a scary diagnosis head on, we consider the whole person when looking to treat illnesses and diseases. We have the time to look at every aspect of your life, organize tests as they're needed, and answer any questions that you might have. Functional medicine really provides a framework to find out why you feel so unwell and what needs to be done to get you better. So every symptom you have, every differential diagnosis, there may be the many contributing factors to your illness. And we don't just look in a medical book to find out how to treat you and make you well. We look at your body and we listen to you. Your body holds the answer to a better and healthier life. And functional medicine is an active form of treatment. And it's important that you are ready to commit to a new and better way of living. The fact that you're listening to this all this time is a sign that you're really ready to take that responsibility and move forward in every aspect of your life. After all, to feel healthy isn't just about the lack of disease. It's feeling free to live the life that you deserve. It's allowing your body and mind to thrive and to live a healthier and happier life. So that's all for me for now. Thank you for listening. Please do get in touch to learn more about how we practice this type of medicine and what this model can do for you. This is Dr. Gayatri working in partnership with you to design personalised medicine so that you continue to thrive today, tomorrow and always. Bye now.